Hello, everyone. This is John Turner-McClelland with Cooper Mac Realty Group. I'm here today with Dr. Robert Brady of Brady Chiropractic. How are you doing, Dr. Brady?
Doing well, thank you.
Great. We finally got you scheduled. You were one of my first choices to do this, and we have not been able to get it on here until now. And
I definitely had some stuff come up, and I had to learn how to do a lot of video things in the midterm.
You are the Zoom virgin. So tell me about Brady Chiropractic, when you first opened the practice, and why.
So I moved here to Texas in 2004 after being up in New York in practice since early '98. And we moved down here after 9/11. It was one of those interesting times. We kind of came to a place that we felt like it was a little more stable and secure at the time. So we opened up in May. I bought a practice from a retiring chiropractor who did a similar technique as mine, which wound up being an ideal situation there. And I've been in practice since 2004 at two locations here. One was actually across the street from where we currently are, where Home Depot. So we moved to the southwest corner of Custer and Parker, and we've been here since '05.
And why did you move to Texas, other than just you wanted to get out of New York? And I think you originally wanted to go to Colorado. Is that right?
Yes, actually, yeah, we had a kind of funny little thing happen there. So after when we made a decision to leave New York, we looked at a couple of places. We looked at all the C states: Connecticut, the neighboring state, and then Connecticut, Colorado, and California. Colorado was the one we were actually looking a little more closely at. But what was interesting was me and my wife were using the same computer when we were doing our searches, and we both clicked on chiropractor, and my wife clicked clinics in Colorado, so specifically Colorado Springs, and it doubled the amount of chiropractors that were in the area, which turned us away from there. Texas wasn't on the radar at the time, but my sister-in-law, who lived in Dallas, she was getting engaged at that point. We came down for an engagement party, and we loved it here. And so we searched around for a little bit, and then I searched around some more for about 3 or 4 months, and within about a 6-month window, we had moved down here.
I started going to visit you probably a year before the pandemic, but I know we had some challenges during COVID pandemic. How has it actually affected your business, or has it at all?
Initially, it affected us the very first few months. It was pretty significant. We had closed our office. At one point, I had a positive COVID test. I don't have any antibodies, so I don't know what happened there. I didn't wind up with any symptoms, but there were several times we had closed the office to either update our policies, clean the office down, because I didn't know if I was going to infect early on. It definitely, there was certain patients that showed up that kept our clinic going for a while there, because like most medical offices, they were either doing things remote or seeing less patients. It's impossible to do chiropractic remotely, so we had to stay open at some point. So it was a challenge for a while, but we've been here long enough, and we had a strong enough core of patients, yourself included, that showed up when other people, and I fully respect what they were doing, was protecting their family, protecting themselves. So
Yeah, your I guess false positive test spurred me to get my own test. Thankfully negative.
yes.
I didn't have anybody's either, so I've never apparently ever been in contact with it.
Yes. No, some part of me says, if I'm not going to have any symptoms, boy, I'd sure love to have the antibodies, though. But that didn't happen.
Yeah. Well, at least now we have vaccines, so hopefully everyone will get that done.
It's been a game changer. Hopefully everybody does do that.
Right. Going forward, do you see any expansion of your office? I know you have still waiting on repairs of your office. Yeah, our viewers might remember me interviewing gentleman who owns an aquatic.
Sorry, go ahead.
Yeah, a guy owns Exotic Aquatics, which is actually next door to Dr. Brady's office. And I guess one of their aquariums exploded or something and flooded your part of your office.
Yes. Yeah, that was a fun walking in on a Tuesday afternoon and having that in the office. So yeah, we're in the process of getting that repaired, and that should be done hopefully pretty soon. It's been longer than I'd like it to be, but my patient's been patient with it. And luckily we have a big enough office where I moved my adjusting section to a different spot and was able to keep functioning.
So tell us what you do for patients and what they can expect when they first go to a chiropractor.
So chiropractic in general, we're trying to mostly get joints to move that have been either stuck for some reason, potentially degeneration or something, maybe just a bad night's sleep, but something that it isn't moving properly. And we try to get that to move back to its normal motion. So that may require working on the muscle, working on the vertebra, working on an ankle joint, whatever it may be, to restore the motion back. Our ultimate goal is to make sure that the nerves, which are the central reason that you'll know you have pain or an inability to move, they will send some signals that will be shut off or maybe even being magnified. So what we're trying to do is make sure we restore that normal nerve flow so that the patient can return to their normal activities. One of the things that I do differently than, say, many other chiropractors is I do a technique that's involving flexion distraction of the spine, which means I stretch the spine specifically at certain levels. So similar to a traction table or some type of hanging device that you stretch your body, except I will hold individual vertebra and stretch the chain between those two vertebrae. So it magnifies the ability to open up the spine and open up the nerves.
Right. I've noticed I used to go to a different chiropractor since I lived in a different area years ago. And they always had with me, they would use what I call torture rack, stretching you like that with the belt, and then having the machine is pulling on you to, I guess, deal with the vertebrae, the discs. I notice you don't do that.
Yeah, it's so they're using a mechanical version, or some people even have a computerized version. I do the manual version. I find that the feel is better with my hand if I can feel an individual vertebra. The other part that I like about the technique that I do, and I do a lot of different techniques, and other chiropractors have great success with other techniques too. But I feel that I can move at different points during the treatment. Whereas if you're using a machine, you're pretty much static. That's what you're going to stretch, whatever that was set to stretch there at that point.
I notice some insurers do not care for chiropractic. At least mine will pay for part, or at least several, mine's a certain amount of year visits. Some won't pay at all. I find that kind of odd, given the fact they would rather pay for back surgery than trying to deal with someone's pain issues.
It is a very strange issue that they'll pay a $70,000 surgery, but they don't want to pay for a $50 or whatever the insurance allotment is adjustment for to try to keep them from needing that surgery. There's the part I love: interacting with patients, adjusting patients, getting them better, or at least getting them to some place where they can get better. And there's the part that most chiropractors will not like, which is the insurance side of it. Constantly dealing with issues, constantly updating and changing things that seem tedious at best, and they don't really actually affect care, except I think mostly in a negative way. So insurance is definitely one of those. They're very difficult and very hard to deal with. I try to stay as far away from the insurance side as possible. I push that off onto other people. I accept all insurances. We're in every network, and I've been in them for 20 years. But I let other people handle that part. I try to stay as far away from. I want to keep my sanity while I'm working.
Yeah, it's best than trying to to
Yes.
collect on something so simple. At least with mine, with you guys, you can also bill as physical therapy,
Yes.
which I have quite a bit on that side from my insurer, which I guess is a plus because that's not surgical. So they do realize something, not what they should. But although I did have, one previous employer that also paid for acupuncture,
It was nice.
mainly
Nice.
because we're a Taiwanese company. So it was self-funded insurance. They made sure that acupuncture was covered.
That is good. Yeah, there are some plans. It's interesting. It's, of the major insurance carriers, there are some plans that cover things that I wouldn't think they cover, and also there's some plans with some big employers in the Plano area that don't cover some of the basic things that you would expect them to cover it in the year 2021. So now they find ways around it. Something that's interesting too is that for the most part we don't have to deal with it too much, but there's supposed to be a law against pre-existing conditions. Well, they still fight those, and they still say things are pre-existing in certain cases. So it's kind of interesting. I don't know how they get around some of these laws that are seem concrete in the books, but they figure out ways to do it.
Yeah, insurance is not for us. It's
No.
for the insurer. Their job is to make as much money as possible. It's not
Do a
healthcare.
good job at that.
Insurance is not in the healthcare industry. That's for sure.
That's a
That's
good.
what they cover, but they're not in the healthcare industry.
That's a very good way to put it.
Yeah, not doctors anyway. They are in an industry. It's not caring for patients. Well, Dr. Brady, I'm going to let you go here in a moment so you can get back to your patients. It was great talking to you.
Good speaking with you too.
Hopefully everyone watching, if they need a new chiropractor or have never been to a chiropractor, will stop by your office and get scheduled and get rid of the pain.
Excellent. They can look up Brady Chiropractic Plano.com, or our phone number is 972-867-8500.
Right. Everyone watching, it's John Turner-McClelland with Cooper Mac Realty Group, and have a great day.
John, have a good one.